Hello, thank you for your patience. Welcome to the ESIP webinar on the Quality Hospital Discharge Training Programme presented by Lucy Pasfield, Discharge Pathways Project Coordinator from the London Borough of Camden. First, we have just a few simple housekeeping points. This session is being recorded and the recording will be available to view on our website shortly. All attendees are muted to avoid background noise during the recording. At the end of the presentation, there will be the opportunity to ask questions. If you have a question, please use the raise your hand option in the panel on the right-hand side of your screen. Alternatively, you can write your question in the question section on the panel. During the Q&A sections, we will unmute you to ask your question in person. Thank you, and I'll now hand you over to Lucy. Thank you, Lucy.
So thank you, Paula. Hello, hi, thank you for the introduction. I am a project officer and I work on the Better Care Programme Discharge Pathways project for the London Borough of Camden. And just to give you a little bit of background about my experience, so I don't come from a clinical or social care background, so do excuse if I've incorrectly used any health terms. And I'm here today to talk about why and how we developed and ran an interprofessional cross-agency training programme to improve the quality of hospital discharges and transfers of care in Camden. So this first slide here is really a bit about the why we decided to run this training programme, why we thought it was a priority to set up program in this area. So just to give you a little bit of background about the delayed transfers of care situation in Camden. Camden is a inner London borough, and one of our big problems is a lack of available care home places in the borough. We've got two big acute hospitals, which are the Royal Free and the University College Hospital. And in the north of the borough, we see some very high rates of admissions of the over 75 age group, primarily because that's where the care homes we do have are located. So in 2014-15, we had below comparative borough average delayed transfers of care rates, but we had higher than average adult social care attributable rates. And actually, I looked at the 15-16 provisional figures just before preparing this, and actually saw that we now have in the borough one of the lowest rates for adult social care attributable delays in our comparator group, and actually a very low overall rate. So I can't put that at the door of this initiative because we hadn't got this established during 15-16 reporting time, but hopefully we will see the impact in the next year's figures. And we did have some other initiatives that we instigated this last year to bring those rates down. But so in Camden, we also have situated within the council, but employed across the whole system, health and social care system. We have a small whole systems team, and it's our job to work with the trusts and the care providers to try to keep down the delayed transfers of care rates and to try to ensure that we have good, robust discharge pathways for patients in the borough. And one thing that the whole systems team do is oversee the discharge alert process, and that's like the quality assurance process for the hospitals. And I don't know whether maybe you have a similar process in your areas. It's for those who don't, it's just basically where health and social care professionals like district nurses or social workers can report unsafe discharges or discharges which haven't followed best practice. So we receive the alerts and we send them on to the hospitals responsible for the discharge for an investigation and a response, which should include some organisational learning to try and prevent these issues occurring again. So we were seeing issues coming up with poor quality discharges, which often resulted in emergency readmissions for those patients. And as I mentioned, some higher than average adult social care attributable delayed transfer of care rates. So my manager, the whole systems coordinator, really was the one who came up with the idea of having a whole systems training program. And the idea was to try and improve the quality of discharges and embed the best practice into discharge planning and transfers of care. And we also wanted to try to reduce the risk at transfer points along the pathways by bringing the professionals together to try and overcome these barriers. So to do this, to really make the training interdisciplinary and cross-agency. So the aims of the programme were refined down, and I've put them here on this slide. So as you can see, are to educate and reinforce to staff how to achieve high standards of discharge planning and transfers of care across the whole system. To put the patient at the centre of discharge in order to provide a safe and positive discharge experience. To improve the discharge pathways for hospital patients, and really where possible to involve service users in the planning, implementation and possible delivery of the training. So it has been funded by the Better Care, I think it's called the Better Care Programme Fund, which has been very helpful in that it has meant that we can offer the training places free to any attendees who are working in discharge in Camden, really across the whole health and social care system. So these were the outcomes we would hope to have seen from the training, but I'll talk about these a little bit more again when I talk about the evaluation at the end. But we would basically hope to see, a reduction in the number of discharge alerts completed by the healthcare professionals to help demonstrate that the quality has improved, the quality and safety really of discharges. We would want to be able to see earlier discharge planning. This hopefully would lead to a reduction in emergency admissions, and we would see service users return to optimal independence and activity in the community. So my manager put together the bid and submitted it to the Better Care Programme, and it was successful. And then she was then given the go-ahead to recruit me and get started on the programme. And so this slide is a little bit about the how we went ahead and developed the programme. So I was employed to lead on the development of the training programme. And so from the outset, the plan was to develop a collaborative whole systems programme with all stakeholders involved. And that included the hospital trusts, care providers, the voluntary sector, the council, adult social care staff, and all the service users. And so to do this, we started with forming a training planning steering group, and that had roughly 25 representatives on it, one from each of the stakeholders. And we tried to bring in service users' views on the steering group through the voluntary sector who supported them in the community. So for instance, Age UK and Camden Carers are two active voluntary sector organisations local to us. And we had the Older Persons Commissioner as well. We had ideally actually wanted to have service users themselves sat on the steering group, but in the reality and the sort of practicality it was difficult to find people who were willing to come along and able, because with quite frail and elderly people, it's difficult for them to come to steering group meetings. So to get round, or trying to bring in service users' opinions, I held some focus groups. So I held 2 focus groups with individuals whose discharges are considered the most complex, and the groups who are most likely to get delayed in hospital. So that was sort of frail older people and people with mental health issues. And this is kind of really what I'm trying to show in this filter diagram on the left here. So that's all the different factors that influence the training program content, all that information sort of filtering down into the training program. So the steering group met regularly to steer the program, and I busied myself in between meetings on going off and developing the program. So people were keen that the program was really aiming to change behaviours of the staff, and so we decided to include an interactive theatre session as part of the day, as a way of really sort of challenging people's current mental routines and their behaviours and their assumptions, and getting them to modify them. So we were really fortunate to work with a great theatre company called the Geese Theatre Company, and they're a charity who were willing to take on the topic of hospital discharge. So we formed a working group of different senior professionals to work with their artistic director to shape some suitable scenarios. So when I say they are an interactive theatre group, the attendees aren't asked to come up and role play. The Geese Theatre Group have this great, what they call non-didactic technique, where they break a scenario at key points and pose questions to the audience, and then facilitate small group discussions and feedback what they've heard. So I don't know if you've seen one of these sort of types of theatre groups in operation. Actually, they're a very effective way of sort of getting a message across to people. People can be really involved, they can participate quite fully because they don't feel inhibited. And actually, from our evaluation, we found it's something that had a really strong impact on people. So one of the risks for the training program was lack of buy-in from the stakeholders, because I really do think that to make a very successful day, you really need staff to attend from all the different agencies across the system, and for them to come and learn together. So all the stakeholders really need to share their knowledge and learning resources as part of the day. And I must say there was a little bit of initial reluctance from some areas, because you are bringing people together with very different perspectives about how a discharge occurs, and some history about what can go wrong, and some has working relationships which not always straightforward. So so there was a bit of reluctance to overcome, and I just overcame this by keeping on talking up the day and building some credibility for it, so that actually eventually no organisation really wanted to be excluded. And actually what I found was that the people who were initially a bit reluctant, actually once they overcame that and you got past that with them, they were actually very passionate and enthusiastic and knowledgeable areas, but they had just maybe were a bit frustrated about some of the ongoing problems, and maybe a bit skeptical about what training could really achieve in this area. But bit by bit, the content came together, and so eventually we were ready to run a pilot day, and we ran that in April of this year with 20 attendees from a range of sectors and levels of seniority. And actually it was really useful to run a pilot day, I found, as it gave me a chance to gauge people's reaction to the content and presentation of each session, and make changes to the structure of the day to reflect their feedback. And actually we did make several changes to the flow of the day, the running order of the sessions, and the session content as a result of their feedback. One example was that we originally had patients and carers speaking in person at the front of the group, about their discharge experiences and their negative experiences, but we realised that this was a bit unpredictable, as people said things that we weren't expecting them to say during. So we thought it would be better to record interviews with the patients and carers and edit this into a video and then show the video. Plus also you then didn't have the problem of trying to coordinate people attending on different dates. And again, as I said, some of the individuals who have got complex discharges are people whose health might not be robust over a long period, so it would be difficult for them to keep attending and doing something that's quite emotionally draining as well for them. So the improved training day was then promoted widely across each of Camden's trusts through key contacts, through Camden Council with targeted emails and a blog, and to home care and community care providers via strategic commissioners who are located within the council but have contacts out in these organisations. And as I mentioned earlier, because there was no charge for the day, because it had been funded by the Better Care programme, actually we got a really, really good sign up and people were really keen to come. So I think that the fact it was free did help. So then we ran the programme, and here on the left is the final programme from our most recent day, which the attendee feedback suggested worked best. And I don't know if you can see, it's quite tiny writing, but in case it's too tiny for you, we have the first session that covered best practice on discharge planning in the hospital, and that was delivered by some of the senior discharge staff alternating from our two big acute hospitals. Then we had a session on discharge planning options within Camden, and that was delivered by, again, senior professionals who are running the community services. And then after lunch we had the theatre group and their facilitated scenarios, as I mentioned earlier. And then we had the video of patients and carers talking about the impact of good and poor quality discharges on their recovery. And then that was facilitated so we could sort of look at some of the issues that they were raising and why they might be thinking and feeling the things that they felt during their discharges, and where communication had been poor, for instance, and how that led to their perception of the overall experience for them. So that's very interesting thing to look at. And then for our final session of the day was the voluntary sector community services, talking about what they can provide during and after hospital discharge. And the two big voluntary sector organisations that we have operating in Camden are the Camden Carers and the British Red Cross. So we tried to mix up different delivery approaches to accommodate a range of learning styles. So for instance, the discharge planning option session was run as a case study problem-solving activity, whereas the video allowed for visual and verbal learning. So we ran 3 training days over the course of 3 months and trained 102 people, and staff attended from a wide range of organisations across health and social care. So that included from the acute and the non-acute hospitals, the adult social care staff from the council, the home care providers, Mungos, and mental health Foundation Trust. And actually that all those staff came together and learned together in an interdisciplinary cross-agency way. Actually was a really successful aspect of the day, because there was a lot of cross-learning going on between people, which again I'll talk a bit more about. I'll talk about the evaluation, but 80% of attendees fed back that they found it useful to train with all the individuals from other organisations. And in the end, each day was fully booked with a long wait list. So it was a very successful day. Well, each of the days were. So now I'm going to talk a bit about evaluating the training day, and what Camden as a borough has really got from training staff in this area. I evaluated using the Kirkpatrick model, which is shown here, and tried to evaluate in alignment with the different tiers here. So the lowest tier was looking at the reaction to the day, so asking people what did they think of the content and the activity levels, the knowledge they've got, that sort of thing. So evaluated on that level. And then the next tier is about the transfer of learning. So we asked attendees to rate their knowledge of discharge before the day and after. And on average, over the 3 days, there was a 40% increase in attendees' rating of their knowledge. And to try and help embed the learning and really changed the workplace practice, we asked the attendees 2 questions at the end of the day. Firstly, about how will they take the learning back into their workplace? And then the second question, did they feel able to change their workplace practice? And if not, how could we support them to do this? So we wanted them to really think about what they could specifically do in their roles and start to sort of visualize themselves going away and doing it. So then the next tier of evaluation was looking at the behavioural changes of the attendees. So I conducted some interviews 4 to 6 weeks after training with a cohort of 10 attendees to really look at the impact of the day on their workplace practice. And I would sort of say, generally, in summary, different professionals from different sectors learn different things. So it did depend on their role in discharge, and also their seniority and their background knowledge. But there were some common themes to their behavioural changes, and I've listed them here. And one thing I found very interesting was that some of the learning was as expected around the improved knowledge, improving the processes, but actually a lot of it was about, sort of slightly unexpectedly, about people's changed attitudes to discharge planning and sort of a sort of feeling of empowerment and focus they then got for them to be able to go away as individuals and look to see what they could do to improve their general area. So I have to say that was what particularly impressed me, the things people had done and gone away and done, which I'll give you some examples shortly. But yeah, so the first theme was around improved understanding of the different discharge pathways and the roles different professionals have in them. Somebody summed it up by saying, now I know who to contact and how to contact them, which saves some time and prevents mistakes. And several of the interviewees mentioned they found this. One person said that they had not received any training around discharge, only admissions avoidance. So it was helpful to them to understand the whole of the patient's pathway into and out of hospital. Another person said it did help them come to terms with some of the difficulties sort of with this challenging area. And one I thought was quite interesting from a community-based social work found, said that he actually found it quite intimidating to go into a hospital environment and sort of assert himself as a professional, because could be quite an intimidating environment. It wasn't a familiar environment to him necessarily, but actually it sort of, by having an insight into how a hospital ran, it gave him increased confidence to be able to stand up for sort of his views, to make sure that discharges were safe. So some of the attendees have been able to sort of flow and share this information throughout their organisations via team meetings, again, which was something we asked people to do where possible. The second theme was around improved awareness of the importance of placing patients and carers at the centre of discharge planning. And actually one interviewee commented he would make sure his outcomes were client focused. One discharged sister said that she was making sure she was holding her family meetings at the outset of discharge planning. And one social worker had said that because he found patients were often unable to speak clearly about their discharges, he was making sure he was speaking to family members and carers about their discharge planning. So, I mean, obviously this was a very important theme and point that we wanted to get across to people, to make sure it was a patient-centered day, and, you know, to really make sure it was a priority that people were communicating well with patients and carers. The next theme down is improved communication with all staff across different agencies. Actually, at the start of the day, we asked people to list the challenges that they found with their roles, and this was miscommunication with staff from different organisations was what everybody, without fail, put down as their biggest challenge. So actually this was a really interesting area that has improved people's behaviours, because several interviewees said they found it useful to just put names to faces, and help them work more collaboratively. Several people said that they had got a better understanding of the priorities and focus of others and the constraints of the systems that they were working within. So, for instance, like how social workers agree funding for care, or how the pressure for hospitals to discharge promptly. And two of the interviewees I spoke to had subsequently invited staff from other agencies that they had met at the day to come and speak at team meetings about the services they provide. Actually, I was in a meeting recently, and housing colleagues at the council mentioned they had started outreach work with the hospital discharge team to try to identify people who are at risk of readmission due to their housing conditions, and they said that was on the basis that they had an awareness of, you know, that these discharge teams existed in the hospitals, which they hadn't really realised before, and then had started to think along those lines. So this was sort of examples of going back to sort of giving people a sort of sense that they, sort of almost of empowerment, that they can start to look at their areas and see what they could do to try and improve the quality of hospital discharges. So the next point down is about better awareness and ability to anticipate and identify earlier potential discharge issues and plan accordingly. So a good example of this was an attendee who worked for Mungo's, who said that really it did change the way that the Camden Mungo's and her assessed clients, because they were had a better awareness of the types of issues that may prevent people from moving on successfully into, among us have some step down beds, so to prevent people moving out from their step down beds. So they were now looking to try and identify those issues earlier, So things like safeguarding concerns or social care needs, and sort of take action accordingly where they did identify those challenges. Next point down, it's talking about more knowledge of the assessment process and discharge notification process. So this was a sort of just about knowing what information was relevant to put into the referral forms and the notification forms. So that was saving people time, because previously information might have been missing, and now it was being included. And somebody said that then they understood the expectations around the time frames to for these forms, that they could actually prevent delays, because they could start these processes in a timely way. We provided quite a lot of resources actually for attendees, so information about the different community services that were speaking at the meeting, and referral forms and some best practice guidance. And I think this was useful, again, for attendees to take away from the day, to have to refer to. And actually, some people mentioned that they had shared them in their organisations when they got back from the training day. The last point is about better understanding of the voluntary sector services on discharge. So one interviewee was now referring service users to the British Red Cross for helping getting them to and from appointments. And actually the British Red Cross had new referrals, which on the back of the training day. So that was very useful, again, for everyone to know more about what support was out there and how it worked exactly, to be able to support, particularly with clients and patients who don't necessarily trigger the threshold for sort of proper social care, full social care support, but maybe still do have care needs, and they could be supported by the voluntary sector instead. So on to my last slide here, which is really some of the conclusions that I've drawn from running these, sort of developing the program and running these days, and some of the recommendations I would give to people who are maybe thinking of doing something like this in your own area as well. So so I would say one recommendation really is to get total commitment from senior professionals working in each sector across health and social care, because actually that was just really, for us, it was really key to shaping and delivering a really successful interprofessional cross-agency day, which really did, for us, it underpinned sort of achieving the aims of the programme. So I do feel that the aims that we set out at the beginning were met through the programme, or stated aims. And having spoken to these interviewees who were evidencing improvements to their workplace practice, really that does sort of evidence improvement of discharge pathways for the hospital patients. It was really good to be able to involve service users in planning of the content and implementation and delivery of the training day, because again, just to keep it patient-centred, keep it focused on their experiences, because again, I think that can get lost sight of, and actually people's experiences are actually quite different from what organisations are setting out to achieve. So it's kind of easy to lose that, I think. So we did have some outcomes that I showed you right at the beginning, and I would say really I can't evidence at this point that we have achieved our expected outcomes, because it's very hard to categorically say that sort of improvements to performance outcomes were just down to this training, because I think there are so many other health system factors which impact on the delayed transfers of care, performance data, and the emergency readmissions performance metrics. But I suppose it really, hopefully this initiative will be one part of a range of initiatives that we will see an impact in the end on reducing the bed blocking, delayed transfers of care. And during the training day, actually, we encourage the attendees to use our discharge alert process and report poor quality discharges and unsafe discharges. So we think we probably will actually increase the number of discharge alerts initially, because they are non-mandatory in Camden. So we think there probably is under-reporting of problems at the moment. But I think, again, by encouraging people to report what's going wrong, and then the hospitals to have to feedback on how to prevent them happening again, actually it's a sort of iterative improvement process that, again, we hopefully will reap the benefits of with better quality discharges and the reduced emergency readmissions in the future. So that's my little picture. The funny goggles on is really looking towards the future and what we were going to do next. So Camden as an organisation does feel that the benefits of this programme do justify it becoming an ongoing programme. And we currently have 6 further dates scheduled, starting in a couple of weeks, with the potential to train a further 170 people from across the health and social care. And we're going to run a collaborative training day with University College Hospital, and it will be a similar interprofessional and cross-agency whole systems approach, but we'll be able to bring in some of the expertise and resources, particularly from the hospital. So that's me and the presentation and on the Quality Hospital Training Programme. So thank you all for listening, and I think we have a question and answer session now as well.
Okay, thank you, Lucy. That was great. Yeah, as Lucy said, we've got time to have some questions. If anybody's got any questions, you can either use the raise your hand option, and then I'll be able to unmute you, or you can type in a question and then I can read it out to Lucy. Oh, we've got one question, Lucy. It's from a lady called Emma Owen, and Emma's question is, does the Trust have an escalation and choice policy in place around discharge, and was this part of the training package?
Okay. Do you know what? I think I probably need my manager to be able to answer that question, actually. There is an escalation policy. So it was something that, no, it was not something, we didn't really bring that into the training program, because this was probably a more sort of, I don't know what's the word, sort of face-to-face level, maybe a more simple level about their actual sort of 10 steps of getting the discharge planning right, good discharge planning practice. So sort of less about going into what might happen, how we resolved more complex problems. So although there was quite a lot of discussion that went on in the room about what people might do in certain sort of complex scenarios, and the senior professionals in the room were able to sort of answer queries as they came up. But no, we didn't really bring that into the day.
Okay, got another question from Michelle Woodward. Michelle's question is, oh, Emma said thank you for your answer. Michelle's question is, how are discharge alerts made and where do they get sent?
Okay, so a discharge alert is we've created a form which is just asking, so the often sort of community sort of health providers, like maybe sort of the GPs or district nurses or social workers, as I said, that they can fill in. So it's a form that asks about or has room for people to report what went wrong with the discharge and what the impact on the person was. So the healthcare professional will fill it in and will send it to the whole systems team at the local authority, which is us, and then so we would then sort of keep a record of these and we'll send them on to the discharge teams at the hospitals for a response and for investigation and some learning, what the learning outcome is for the hospital. So it's a sort of circular process that will then get fed back to the whole systems team, who will then feed it back to the person who reported the incident in the first place. So it is a good system to have, to be able to pick up some of the sort of trends and issues around poor quality, and we tie it back to the sort of 4 key issue areas in the Ombudsman's report that was out recently. So I tried to look for themes to bring up with the hospitals.
Okay, thank you. Got another question. Michelle said, thank you, sounds helpful. We've got another question from A. Hines. Question is, what do patients / service users say about what would improve / make their experience of discharge better?
Yeah, that's quite interesting. So the mental health service users that I spoke to at the focus groups, actually they had sort of mixed experiences of discharge. So where they had positive experiences around how their discharge was sort of talked about from the very first moment, but staggered, that was quite a useful point to pick up in the training. Also about how they had experienced sort of lack of multi-agency working, and sort of the importance of multi-agency working. Again, that's something we picked up through the theatre group scenarios. And actually, that's where the theatre group was quite good at being able to pick up some of the sort of softer side of things. So they had also, one mental health service user talked about sort of trying to restore his dignity, because when he'd had an episode of poor mental health, he found his dignity was very low point, and actually how you were treated in the hospital was quite important, because you were looking to have your dignity restored to you rather than sort of further removed. So again, these were sort of through having a scenario about sort of discharging somebody with mental health issues. We were able to sort of pick up sort of some of those sorts of attitudes and sort of portray some of that in the theatre. And as I said, it's a very powerful thing that people take away from the training day, sort of seeing these sort of things sort of acted out in front of them. Yeah, the frail and elderly people that I spoke to, I suppose the main thing for that group was more about sort of good communication, really. So for them to understand how they were going to be discharged, and how they had worries about how they would cope back in the community, and how that was be taken care of. I guess maybe there had been a loss of confidence prior to the discharge, and that's manifested itself in people being quite anxious about when they would go, which day they would go, and so they didn't like, one gentleman particularly didn't his discharge was brought forward, and he hadn't sort of been prepared for the fact that it might be earlier than he'd expected. So he was obviously sort of quite anxious about it, that it was on a particular day. So that was a bit, and that was something that we could get across in the videos, with people talking about what their negative perceptions, for sort of staff to realise really that you know, people might say one thing, for instance, that they're fine with something, but actually they're just sort of saying what medical staff think they want to hear, and then you know, they I'm losing my thread here a bit now. They're a bit, I guess they were a bit anxious, and just to make sure that you know, people are prepared maybe for changes to the plan. Sorry, I was losing my thread a bit at the end there.
Okay, that's great. Thank you.
Okay?
Yeah, that's lovely. Thank you, Lucy. The next question we've got is from A. Hine said, thank you very much. Next question is from Mary Heslin. Question is, how can we implement this training in our own organisation / network, and what resources / support are available from NHS Improvement? Thanks.
Sorry, I just lost you a little bit in that question.
How can we implement? Yeah, sure. How can we implement this training in our own organisations / network, and what resources / support are available from NHS Improvement?
Cool. Okay. Well, I mean, I guess we were able to do it in Camden because through the Better Care programme, and through putting in a bid and getting the resources to be able to fund a post like mine. I mean, it's a part-time post, but you know, still a sort of a cost associated with it, and fund sort of some of the training costs. Elements, for instance, the theatre group need paying as well. So you know, so yeah, I'm not sure what else is out there other than the Better Care programme. I mean, I think you could do it as a sort of add-on to somebody else's role if that person has sort of got the enthusiasm to take on that extra work. And actually all the sort of senior healthcare professionals and social care professionals who sort of did collaborate to make the day and deliver the day, actually obviously they were doing it all for free, just as part of on top of their day jobs. So there was no sort of cost implication there really. So yeah, I mean, it wasn't massively expensive, is what I would say as well. You just, you know, need us.
And following on from that, Lucy, there's a
to be able to pay for the. Yeah.
Sorry, following on from that question, there's a one from Heidi Barber. What was the costing of this project?
So I guess including my wages. Do you know what? I should have looked at that. I should have looked at that beforehand to see exactly where we're up to. Probably to do those 3 training days and the sort of all the build-up work and sort of all the costs associated with that. Let me see. I'm just quickly trying to work it out. Maybe about £30,000. Yeah, I think probably all in about 30,000 for those days. So that's including the yeah.
Okay, that's lovely. Thank you, Lucy. Just checking, it doesn't look like we've got any more questions at the moment. Please feel free, if you do think of anything after the webinar finishes, you can always send an email to our mailbox, which is esipinfo@nhselect.org.uk, and we'll certainly pass those on to Lucy for you. Is there anything you'd like to say, Lucy, before we finish up this session?
No, but thank you. I hope it's been useful, and I'm very happy to speak to anybody if anybody would like to know anything that I haven't covered, or got any other questions or anything. Then just absolutely happy to talk to anybody anytime. So
that's lovely. Thank you. So, like I say, just give us an email if you do think of anything after we finish. And just to say thank you to Lucy for taking the time out to provide us with this presentation. We really do appreciate it. And just a reminder also that the recording of the webinar will be available on the ESIP website shortly to view. So just to say goodbye from all of us, and thank you very much for dialing in today. Thank you. Goodbye.